Hi there. I'd like to talk about relapse prevention. One of the analogies I use quite often with patients is the analogy of need for compliance with medical care. And an example I use is I was a family practice physician for 26 years in West Virginia. And I would treat a high blood pressure patient. They initially would come in, we'd make the diagnosis, we'd do the lab work, we would prescribe medication, ask them to take the medication, come back in 2 weeks, and we'd recheck their blood pressure. Well, quite often, they would do all these things, come back in 2 weeks, and the blood pressure is normal. Then I would just go over their treatment plan with them again and ask them to come back in 6 months. When they came back in 6 months, their blood pressure would be sky high. And when I asked them what happened, they'd say, I didn't think I needed the medicine. Well, the treatment of addiction is very similar. We have patients come to treatment, they go through detox, they go through residential, partial hospitalization, intensive outpatient. We indoctrinate them to 12-step mutual aid. They receive cognitive behavioral therapy, medication-assisted therapy, and then they have a plan of treatment for when they go home. That plan of treatment recommends that certainly they continue to maintain abstinence from mind-altering substances. We strongly encourage smoking cessation. I ask them to continue cognitive behavioral therapy, to continue their psychiatric care, to continue their medical care with their primary care physician, as well as participation in 12-step mutual aid, and that can be the fellowship of their choice, AA, CA, NA. We have no particular preferences there, but we do want them to participate in all of these. Whenever I have patients who relapse and come back into treatment, the answer is very seldom different. The answer I get is, I said, did you continue your psychiatric care? No, I didn't think I needed it. Did you continue your cognitive behavioral therapy? No, I didn't think I needed it. Did you do 12-step mutual aid? Did you participate in either AA, NA, or one of the fellowships? No, I didn't think I needed it. So it's really no surprise that this chronic relapsing disease comes back. These patients do relapse. This is a disease that not only needs aggressive initial treatment like we provide here, but requires lifetime maintenance treatment, no different than hypertension or diabetes or asthma or any other chronic medical diseases that require lifetime management. In particular, 12-step mutual aid has been around since the 1930s when Bill Wilson and Dr. Bob Smith founded Alcoholics Anonymous and wrote the big book of Alcoholics Anonymous. Since that time, over 300 spin-offs or fellowship-style groups that use 12 steps have began and are used for all the different substance use disorders as well as process addictions such as gambling, internet addiction, sex addiction, Overeaters Anonymous. These 12-step mutual aid programs are free. They are effective. They provide excellent peer support, as well as the 12 steps of Alcoholics Anonymous. The 12-step mutual aid programs provide excellent life skills and cognitive behavioral therapy. You quite often hear from patients, well, I went to one and I didn't like it. Well, it's like many other things. You have to search. A good example of a good group for you would be one of your peers. It would be one that is convenient to your house or your workplace. Don't make it too difficult to get to. Once you get to these meetings, utilize what you learned in treatment. We indoctrinate our patients here so that they have a basic understanding of what happens at these meetings. We expect them to get a sponsor. We expect them to work the 12 steps of the program. And very important, the 12 steps that they eventually sponsor other people on their own. Very, very effective adjunctive therapy, along with their medical care, their psychiatric care, their continued cognitive behavioral therapy, or whichever therapy that we have recommended following leaving us in treatment.